Let us now look into a few basic details about ascending and descending pathways. This is the first of the two videos where we will be studying the features of ascending pathways. These pathways are generally termed as tracks. Tracks are defined as bundle of nerve fibers within the central nervous system, sharing common origin, common destination, and common pathway. Functionally, these are a homogeneous group of fibers. The tracks can be ascending tracks, connecting a lower center in the central nervous system with a higher center, or a descending tract connecting a higher center in the central nervous system with the lower center. Sometimes we also use terms like fasciculus, lemniscus, funiculus, or column. So let's find out what these mean. Fasciculus is generally a larger bundle of fiber compared to the tracks. Lemniscus is a flattened or ribbon-shaped bundle of fibers. Funiculus and column are interchangeable terms. Both mean a very large bundle of fibers, and they may contain more than one tract or fasciculus. Ascending sensory pathways may be special sense pathways or general sense pathways. Special sense pathways include olfactory pathway, visual pathway, taste pathway, auditory pathway, or vestibular pathway. General sense pathways include those that arise from trunk and limbs or those that arise from head region. Special sense pathways begin from the specialized epithelium in the nose or retina or tongue or in the cochlea or vestibular apparatus in the ear. And this information is carried to olfactory cortex or visual cortex or gustatory cortex or auditory or vestibular cortex via olfactory pathway, visual pathway, gustatory or auditory or vestibular pathway respectively. We will study these special sense pathways separately at a later stage. General senses are broadly classified as conscious sensations or non-conscious sensations. Conscious sensations are of two types: the exteroception, that is the sensations which are perceived on the surface, and proprioception, that is the sensation perceived at a deeper level of the body, that is from the muscles, tendons, and joints. Exteroception can be perceived by telereceptors, which like retina or cochlea, which perceive the sensation from a distance, or it can be perceived by somatic receptors, which will perceive the sensations by contact, like in case of touch, pressure, pain, temperature, and vibration. Conscious proprioception includes sense of position and sense of movement, otherwise called as kinesthetic sense. Non-conscious sensations include proprioception and interoception. These are the visceral sensations involved in the visceral reflexes. While the conscious proprioception information is taken to the cerebral cortex, the non-conscious proprioception is carried to cerebellum. General senses from the trunk and limbs is carried by the spinal nerves to the spinal cord, whereas the general senses from the head region is carried by the cranial nerves to the brainstem. For these sensations to be perceived, impulses must reach cerebral cortex. Cerebral cortex has predominantly contralateral representation. Both spinal and cranial nerves, however, they carry ipsilateral information. So there is a need for the information to cross over the midline before it reaches cerebral cortex, so that the information which is carried on the by the ipsilateral spinal and cranial nerves reaches the contralateral cerebral cortex. Ascending sensory pathways which need to reach cerebral cortex generally tend to have three-order neurons along the path. The first-order neuron is located in the dorsal root ganglion in case of spinal nerves, or sensory ganglia in case of cranial nerves. Second-order neurons are located in the spinal cord for the spinal nerves, or in the brainstem in case of the cranial nerves. Some of the spinal nerve fibers also may end up in the nuclei in brainstem. The third order neurons are located in the thalamus. Before we go into further details, let us familiarize ourselves with this picture, because this we are going to use repeatedly. It's the spinal cord, parts of the brainstem. This is a section at the level of primary somatosensory cortex. This is a thalamus and lentiform nucleus, and the bundle of projection fibers called as internal capsule between thalamus and the lentiform nucleus. So the ascending general sensory pathways, the receptors to spinal or cranial nerves will be carrying the ipsilateral impulse. The information from the first order neuron to the second order neuron is also transferred on the ipsilateral side. The axons of the second order neurons, however, will cross to the opposite side. And therefore, the third order neurons in the thalamus and sensory cortex will be on the contralateral side. So let us see the pathways. Sensory information from trunk and limbs is carried by the spinal nerves of various segments. Those fibers which carry pain and temperature modalities have their first order neuron in the dorsal root ganglion of the respective spinal segments. These fibers relay their impulse to the second order neurons located in the dorsal horn of the spinal cord at the same level. The axons of the second order neurons cross the midline to the opposite side and ascend as spinothalamic tracts in the spinal cord or spinal lemniscus through the brainstem, and then they reach thalamus. When they reach the thalamus, they relay in the third order neurons, and the axons of these third order neurons in the thalamus is then carried to the primary somatosensory area or the postcentral gyrus by passing through the internal capsule. Those fibers that carry touch and conscious proprioception modalities from the trunk and limbs, they also have their first order neurons in the dorsal root ganglion of the respective spinal segments. These fibers, after reaching the spinal cord, do not relay. Instead, they ascend uninterrupted as dorsal column and reach the medulla. In the medulla, they relay in the gracile or cuneate nuclei, and the neurons of these nuclei will form the second order neurons. Axons of these neurons cross the midline to the opposite side and ascend as medial lemniscus to reach the thalamus. In the thalamus, like the pain and temperature fibers, they relay on the third order neurons present there, and the axons of the third order neurons in the thalamus then carry this information to the primary somatosensory area or the postcentral gyrus by passing through internal capsule, as we have seen earlier. Both these sets of fibers coming from the trunk and limb regions relay in the ventral posterolateral nucleus of the thalamus. The fibers from different parts of the body reach designated areas in the primary somatosensory cortex, and this representation of the body map in the sensory cortex is called as sensory homunculus. Sensory information from the head region is carried mainly by the trigeminal nerve. Those fibers that carry pain and temperature or those that carry touch modalities from the head region have their first order neurons in the trigeminal ganglion. After reaching the brainstem, they relay in the second order or sensory nuclei of the trigeminal nerve, and these neurons will form the second order neurons. Axons of these second order neurons cross the midline and ascend as trigeminothalamic tract to the thalamus. In the thalamus, they relay on the third order neurons present in the ventral posteromedial nucleus, and the axons of these third order neurons in the thalamus then carry the information to the primary somatosensory area or the postcentral gyrus, passing through the internal capsule. These fibers reach the Comparatively, they reach lower part of the somatosensory cortex, as that is the designated area for the head in the sensory homunculus. So this is the pathway for general sensory impulses requiring to reach the cerebral cortex, be it from trunk and limbs or from the head region. To rule out if the ascending pathways are having any lesion, we conduct certain simple tests during neurological examination of the patient. To test touch, we ask the patient to close his eyes and graze different areas on the body with a cotton swab and ask the patient whether he feels the touch. If he is not feeling the sensation, then we map the area, and that may give a clue regarding the site of lesion when we combine it with other findings during the examination. Similarly, when we want to test pain, we test it with a pin, using the pin on different areas of the body. For temperature, we apply hot and cold test tubes on different parts of the body and ask the patient whether he can feel them. There are active and passive tests for testing the conscious proprioception. Active testing is done as a part of the cerebellar testing, so we will deal with it in our video about cerebellum. But for passive testing, we ask the patient to close his eyes and move the patient's great toe or thumb up and down and ask the patient to name the direction. For testing vibration, we use a tuning fork. We use it on some of the bony points like styloid process of the radius or on the tibial shaft and ask the patient whether he can feel the vibration. Do test it on your own body whether you are also feeling till then. Thank you very much. Hope this video was useful. You can visit the site for other videos of similar type. Thank you.